How much did your health insurance premium go up this year? We just closed open enrollment here in the United States where everybody has to opt in or opt out of their health insurance. And, we're seeing drastic increases across the board. So I'm going to share my state and the percent that my insurance went up. I encourage you to do the same. By the way, my name is Aaron. I'm a licensed clinical social worker. I share social work related content. You might be saying, Aaron, how is this social work related content? Because we advocate for the folks that we work with. We advocate for the greater good of society and social justice. So here in the state of Missouri, my healthcare plan with no medical changes, with no worsening health, with no significant things, increased by 17%. That was the same company with no necessary improvements, actually, in some ways, a reduction in some services, 17% in the state of Missouri, and that's for United Healthcare. If you feel comfortable, drop it in the comments below, and I'd love to hear more from you. All right, so it's the end of semester for most MSW students or any graduate students who I keep in my backpack. Let's go. It's going to be a journey together. So first off, you got to have the computer. I'm an Apple guy, multiple screens. US microphones, these are from DJI. Love, of course, my mouse. Battery pack, because you never want to run out of battery. My various jump drives, and then laser pointer. You always want to be ready with extra batteries and a laser pointer. Tylenol and ibuprofen, because you know what? That's part of being in grad school. Let's see what else I've got here. Tide pen, because you never know when you spill something on you. You want to clean that up. More chargers. You never want to be without power. Some fragrance. This is Burberry Hero. Chapstick. Love it. This actually goes on like that. You all give me a lot of shit about it, but I love it. It's a perfect iPhone. Tylenol. Health insurance in the United States is a scam. Prove me wrong. Every day feels like we're negotiating with the villain who holds our medication in one hand and the profit margin in the other. My name is Aaron. I'm a licensed clinical social worker, and if you've seen any of my TikToks, you already know I spend half my life on the phone fighting insurance companies for people who should have gotten care the first time that they asked. Let's be honest, every story that I've told on here, they have one thing in common: saving money, not lives. These companies are built on a business model that depends on one thing: deny first, profit always. They don't make money when you get what you need. They make money when you give up, when you're too tired to appeal, when you don't have someone like me calling, fighting, and saying, actually, no, run it again. And I've seen it all. I've watched them tell a diabetic patient that they don't qualify for a medically necessary amputation. I've watched them deny ambulatory transport for a medically fragile infant because it wasn't cost effective. I've watched them reject cancer screenings because someone typed the wrong modifier, when then told the patient, you'll have to wait until next year. I've watched them try to force people into cheaper medications that don't work just so their shareholders can sleep better at night in the Hamptons. This isn't broke. It's working exactly the way they designed it. And every time I pick up the phone, and every time that I say, put your supervisor on that line, every time I push back, I know I'm not just advocating for that person. I'm fighting an entire system built to wear us down. So if you're listening to this, remember, you're not crazy. You're not overreacting. You're not the problem. The system is. And until it changes, I'll keep doing what I can, calling out, escalating, appealing, and refusing to let these companies screw people to meet their quarterly earnings. Because someone has to. If you've dealt with the insurance hell, drop it in the comments and let's make sure people know exactly how this system works. If you've ever opened a letter from your insurance company and seen the words denied, this is the video for you. Because I'm going to give you 3 steps to actually get your claim approved. You'll want to save this for future use and share this with others. Be sure to watch until the very end for a special trick that I use. Hi, I'm Aaron, licensed clinical social worker, and I fought more absurd insurance denials than I can count. So let's get ready. Step 1, request the exact reason for denial. Insurance companies love vague language: not medically necessary, insufficient documentation, alternative treatment required. No, ask for the specific policy
the specific criteria and the specific documentation that they claim is missing. You can't challenge a denial if you don't know the rule that they're hiding behind. Step two, gather all of your evidence and get your provider involved. This is where you get clinical notes, test results, prior treatments, everything. Then ask your provider to write a letter of medical necessity that directly responds to the insurance company's criteria. Insurers bet on you not doing this step. Prove them wrong. Step number three, file a formal appeal and use their language against them. Submit a written appeal referencing their own policy language. Tell them exactly how you meet the criteria they claim you didn't, and always request your case be reviewed by a clinician in the same specialty as the provider who recommended the treatment. You'd be shocked how often that alone overturns a denial. Now, here's my special trick. Check the CPT codes before you submit anything. Ask your provider's office what CPT codes they build. One wrong code, one outdated code, one mismatched diagnosis, and the insurance will deny it instantly. Sometimes the issue isn't the treatment, it's the code. Fixing that alone, fixing that can flip the denial into an approval without a full appeal. Insurance companies make money when you give up. So these three steps will make it harder for them to say no. If you want a deeper dive or a more specific script for calling insurance companies, drop a comment and I'll break it down in future videos.
I don't understand why PT would be considered as an alternative to a nebulizer machine when she is already having problems breathing. Yeah, this is Aaron Over with social work. 32-year-old female with severe chronic asthma. She's been hospitalized 2 times in the past year due to exacerbation of her asthma. She uses a rescue inhaler daily. Pulmonology is ordering a nebulizer machine. We sent over the prior authorization and it has been denied for two reasons: that the member must demonstrate an adequate response to current treatment, and PT is recommended for this patient. You clearly can see that she's been hospitalized due to failure of that treatment at least 2 times, with her being hospitalized. And then furthermore, I don't understand why PT would be considered as an alternative to a nebulizer machine. Don't you think that the PT will just exacerbate the asthma? I, I'm not understanding your company's rationale or your logic on this one. Ultimately, we were able to have further conversations with the company and get the nebulizing machine approved for this patient.
You're denying this claim for this life-saving surgery as a pre-existing condition. This is Aaron. I'm the social worker. The patient I'm calling about is a 12-day-old male born with a congenital heart defect. Diagnosis is DTGA, detranslation of the great arteries. The aorta and the pulmonary artery are transposed where they should meet the infant's heart. Surgery is to proceed with the atrial switch procedure. That's CPT 33641 and 33645. We submitted the prior authorization and we received denial due to a pre-existing condition. How that can be true. Just to be clear, this is not an optional surgery, that the infant will not survive without this surgery. This is a time-sensitive surgery that needs to be completed no later than 30 days from birth due to the pressure of the heart increasing to a point where it'll be unsafe to do the surgery. We want to ensure also that the family does not have an absorbent bill that happens as a result of this surgery. Yeah, I'm trying to get this resolved for this patient. This is Aaron, the social worker. My patient's a 29-year-old female with a history of documented chronic pelvic pain and suspected endometriosis. We're requesting urgent reconsideration of your denial for CPT 58662, which is laparoscopic excision of endometriosis. I want to provide additional patient info to help get this cleared up. She has 10 years history of severe pelvic pain, which impacts daily functioning, repeated ER visits for uncontrolled pain, 2 prior appendectomies, both negative, failed NSAIDs, failed hormone therapy, and failed conservative management, significant interruption of work and daily life,
and document of suspicion deep infiltrating endometriosis by a fellowship trained specialist. So your denial said that she must demonstrate adequate trial of conservative measures, but she has more than 10 years of documented failures of conservative management. Additionally, your reviewer said that the patient did not provide evidence that her pain persists on weekends, which is not a required criteria. Pain patterns for endometriosis do not vary from weekday to weekends, and requiring that is simply absurd. So today we're requesting immediate reconsideration of the denial and removal of the non-clinical pain log, to a peer-to-peer with a gynecological surgeon experienced in endometriosis care, and 3, identification of any legitimate outstanding criteria so we can get this resolved today for our patient. Yes, ma'am. My name is Aaron. I am a social worker. I'm calling with a 19-year-old female patient. She was prescribed birth control. We just got back the paperwork and the denial. And in the denial, it says preventing pregnancy alone is not medically necessary. There's a special narrative. The reviewer said that they see no documentation of a male partner, so contraception for lifestyle convenience is excluded. So basically, what you're saying is that you all want a penis affidavit to accompany this claim. I find this incredibly insulting and demeaning. Meanwhile, I was working with a 55-year-old this morning, a male, who was seen by a doc, prescribed erectile dysfunction medications, had those filled and approved in 5 minutes without problem. There was no questions about partners or anything like that. That was your company. So I'm really wondering, why is it that when we're talking about things related to men, it's healthcare, but when we start talking about anything as it pertains to women, it's termed a lifestyle choice. These are for pregnancy prevention and reproductive health. So I'm just really puzzled as to how your company can come to these, these. This is Aaron with social work. I'm calling about a 32-year-old female who presents with chronic pelvic pain and heavy menstrual bleeding. Claim for imaging was denied. In the notes, it says the reviewer states pelvic imaging related to the reproductive organs is considered medically necessary only when associated with pregnancy. Preventative or diagnostic pelvic imaging for non-pregnant members is excluded. This was on CPT 76856, complete pelvic ultrasound, and 76830, transvaginal ultrasound. So what you're saying is that you only care about the uterus if it's growing a child, if I'm understanding this correctly. So just some facts of the case. This is not an elective request. This is a diagnostic care request. 2, the pregnancy status has no bearing on medical necessity. Also, the CPT codes that we offered are standard, evidence-based, and recommended. Without imaging, patient safety is compromised. We would also just like it noted that male patients are not held to this standard, that care is linked to whether or not there's a child involved. We request immediate overturning of this denial or an expedited appeal.